So the rationale and objective of particular trial was to evaluate the efficacy and safety of the first Polish novel biodegradable polymer Paclitaxel coated balloon in a setting of a superiority trial for femoro-popliteal arterial disease, in which we compared this technology with basically reference, which is a plain old balloon angioplasty. We basically randomized 66 patients into two groups of plain old balloon angioplasty and the studied microcrystalline paclitaxel coated balloon. And we follow up those patients for 6 months, and the routine control angiography was performed at 6 months. And what we basically shown is that this trial met its primary endpoint of late lumen loss, which was highly superior to plain balloon angioplasty, which was actually 0.5 versus 1.4, and that met its primary endpoint criteria. And on top of it, of course, the restenosis was nearly 3 times lower, and a requirement for repeated revascularization was 2.5-fold lower when compared to plain old balloon. So the balloon is novel in two ways. First of all, it is covered with microcrystalline paclitaxel, so the particles are much more smaller than their competitors. This allows us to avoid distal embolization. On top of that, the process is fully automatic, so the decoding is uniform. And absolute novelty, which has never been used before, is the use of a biodegradable polymer layer, which serves as an excipient. This has been used for the first time. It's made out of polylactic acid. So this is basically the absolute. I think it's a novelty, because we have biodegradable polymer stents, we have biodegradable polymer coatings, and now this technology has evolved into paclitaxel coated balloon for the first time. This balloon technology has been also extensively studied, not only in the clinical trial setting, but that's the top of the mountain. In American Heart of Poland, we evaluate devices on very early stages in a preclinical setting, where the whole R&D process is taking place. We basically move forward, move a little backward, to test the pharmacokinetics of this drug, of the drug release, of the vascular response, and actually we've shown this preclinical study here at PCR 3 years ago. It was published, and basically this first-in-man clinical trial is a consequence of this first clinical study. So basically, we developed this. This technology from scratch, together of course with Balton Company, who owns the balloon technology and intellectual property. I think the recommendations are important, because what we learned from the study is unfortunately where we made some mistakes. The only cases of restenosis where we found in the study group, which were on 20%, which is not much, were the cases where we did geographic mismatch. So it is really important to, first of all, prepare the lesion with a regular balloon. If you get a satisfying result, use a paclitaxel coated balloon, drug coated balloon, which is longer, at least 10 millimeters proximal, 10 millimeters distal. Try to deliver it as soon as possible, inflate it for 60 seconds, and remove it. If the lesion is longer than your drug-coated balloon, take another one. Make sure all the lesion or all the treated area before with the plain balloon is covered. And also try to avoid cross lesions from counter side, so that we avoid scratching of the coating, because actually the only restenosis cases we had were either edge restenosis or a site or a lesion that was not covered with the drug, or where we crossed the lesions from the other collateral side and basically the coating must have been scratched off. So first of all, this is a trial with a surrogate endpoint like late loss. but yet we've seen significant differences in terms of reduction of repeated revascularization rates. But I guess more powerful studies for drug-coated balloons arena are recommended to prove also the clinical endpoints. But another field is the second generation coating balloon. This is a second generation coating balloon, and I believe that we have now faced the stage where we can compare drug-coated balloons between them, first generation versus second generation. I believe in the preclinical setting we've shown that that the second generation coating balloons with the improved coating techniques can provide better vascular response when compared to first generation. So this is what has been concluded also today as a discussion after this trial, that maybe it's time to test between drug-coated balloons, first generation. There are sirolimus coated balloons on the horizon. So I believe that this will be great arena and a great place for debate and clinical trials.